Hello, my name is Ravi Vij. I'm from My Cancer Haven, and today in our Conversation with Experts series, we have one of the leading myeloma folks from the west of the United States, Dr. Jeffrey Matous, who is a clinical professor of medicine at University of Colorado and is running the Colorado Blood Cancer Institute myeloma effort with the Sarah Cannon Research Institute. He's been a lead accruer on a lot of trials, including the trial we're going to talk about. We're really fortunate to have him. So, Jeff, welcome.
Hey, Ravi, it's a real pleasure to be here and to be part of My Cancer Haven. Thank you for the invitation.
So, Jeff, to put it in perspective, what is extramedullary disease?
So, extramedullary disease is, I think, as you know, it's one of the major challenges that we as myeloma physicians have and encounter in our patients. And extramedullary disease, I think, needs to be contrasted to paramedullary disease. So, paramedullary disease is when myeloma tumors form off a bony substrate, if you will. And we see those often around the spine, for example, or rib lesions, that sort of thing. True extramedullary disease arises outside of, it is not contiguous to bone. So that can be in organs, such as we've seen in the liver, we've seen it in the lung, it can be in muscle, it can be in skin, in different places. And the problem with true extramedullary disease is that very often it's a late finding in our patients with myeloma. It's a sign of more aggressive and more evolved disease. And traditionally, very often, it's also been what we call hypo or oligosecretory, meaning that the cells are so screwed up, if you will, that they have forgotten how to make their myeloma protein marker. And so in the past, these patients have been excluded from clinical trials, which has made it all the more difficult for us. And we know also that patients with true EMD, Robbie, as you know, they just do poorly relative to other patients with respect to our treatments.
So, in terms of the advances in myeloma, we've seen tremendous advances. We're going to talk about this redirect study, but how have these new drugs done for myeloma that is extramedullary?
Well, so the true evolution of these past few years